I'm very happy to be invited by the organization of this very well organized conference to share with you some thoughts and some information on the status of e-health in the Netherlands. E-health is about the use of information and communication technology to support health, to support innovation in healthcare. And I will do so from a policy perspective. My name, by the way, is Hans Ossebaard. I work as an e-health advisor at the National Healthcare Institute in the Netherlands. This is situated about here, far away, you probably know. The Healthcare Institute in the Netherlands advises stakeholders in health, insurers, patient organizations, and healthcare providers to promote the development of healthcare standards. What is good care from the perspective of a patient, and to stimulate the implementation of these standards and to collect and publish information for all stakeholders involved. It's a relatively new institute in the Netherlands. I also work at the University of Twente as an e-health researcher, and I will speak a little on the program. I will be short anyway. The urgencies of e-health are, I think, basically the same globally. Our population gets older, we live longer, which means we have more chronic diseases. We won't die of them, but we can cope with them. Comorbidity is rising. The demand for care changes, of course. Elderly people have elder needs and expectations of healthcare. An aging population also means less healthcare professionals, less hands at the bed, so to say, and there's a decreasing budget in view of the rising healthcare expenditures. Another problem is, of course, the healthcare-associated infections and the lowering resistance against antimicrobials, which also present a public health danger. Okay, so basically the urgencies are the same. In the Netherlands, e-health is very much supported at the moment by the Ministry of Health and also of Economics. I think 2-3 times a year our minister sends a letter to the Parliament with enthusiastic information on the use of e-health. And it's actually also supported at the European level. I think a Belgian colleague was not able to join the panel this afternoon, but he would have explained that the European Union is very much in favor because of these urgencies for promoting e-health. And also, of course, for economic reasons, because our societies are developing more and more in service-oriented societies. Okay, the e-health potential, if you read articles in a scientific way or in non-scientific publications, enthusiasm is really, really high. We hope for these urgencies that technology, information and communication technology are part of the problem, are part of the solution. And we read about the potential of e-health to support or maintain the affordability of health, to enlarge the accessibility for everybody, to increase quality of care, to increase safety of care, and to support self-management of patients. Well, who could be against this? Well, nobody, of course. But sometimes I think we are a bit too optimistic about the potential of e-health. Evidence is not so strong at the moment. The evidence base is slowly growing, but to be fair, it's only in smaller parts of healthcare, for instance in teledermatology or telemonitoring. It's not in the full scope, the full wide scope of healthcare that e-health has been proven to contribute to effectiveness or efficacy of healthcare. So we have to be a bit careful about this, I think. In many respects, the Netherlands is a testbed for e-health for a long time, according to all criteria. The Dutch people are very much into technology and into consumer technology, so to say. They're tech savvy. It's of course a wealthy country. Educational level is relatively high. E-health literacy, the ability for people to access, to find and to search and find health information, to understand this information, to use this information, and this is what I call literacy, is rather high. And also we have a creative industry which is very productive in generating technological solutions in health and other domains of life and economy. Sometimes I say e-health in the Netherlands for over a decade it's on the brink of breaking through. But still it has not really broken through. Since a few years we have an organization monitoring the development of e-health, which is actually a good thing to do from a policy point of view, to see, to measure developments in e-health in a quantitative way. And in the last monitor, these 4 issues came about, and you will probably recognize them because they may be very universal. One is finance. Healthcare providers are not really sure if their service is covered by healthcare insurers because it's done in an e-health way. Sometimes this is just perception. In the Netherlands, it is in our basic insurance. It is e-health is covered as long as the content of care is the same. Time and place dependency doesn't matter. As long as the content of care is the same, it's covered. But anyway, reimbursement issues form an obstacle for rolling out e-health at a large scale. Also, previous speakers also spoke about standardization. Extremely important. It's probably not such a sexy subject, but without standardization, you can fantasize about e-health and nothing will happen. I mean, between domains of care, between sectors, between, for instance, youth care or mental health care or clinical care, but also with societal care or police, all these information systems, they contain hubs, and if the information is not conveyed properly according to standards, technical and also functional standards, accidents will happen, which is proven actually. So standardization is a problem. The third issue I call familiarity. Both healthcare providers and patients or healthcare consumers are not so familiar with what is already possible in healthcare. They don't know about it. So they do not come to think of saying to the patient, hey, you might as well use this mobile app, which was approved of by my scientific organization, and let's see how it works out for you. Patients do not say to their doctor, hey, I've heard about this or that, could we try it? And the last point is there's really a lack of management and giving direction at both national level. Well, our Minister of Health is trying to, but of course stakeholders have to execute it, and there's no money down for them. But at the national level, but also at organizational level, there is no strong management and direction. There's a lot of enthusiasm. That's a good thing. But these 4 issues have been identified, and what we did, and we look at these issues for more than over a decade. And how do we take away these obstacles for scaling up e-health and defragmenting it, because it's all in a small scale. At congresses like this, people will say to me, in the Netherlands it's well arranged, everything. I said, well, of course it's true, but I have to disappoint you. It's very small scale and very fragmented still. How can we prevent that people are inventing the wheel every time and again in their own little organization? Okay. The 3 main stakeholders, both patient organizations and healthcare providers and healthcare insurers, went together, and they made up an e-health agenda, so to say. It was sent together with a letter to the Parliament, it was sent as an attachment with this ministerial letter to the Parliament. Okay, this e-health agenda was actually a kind of statement, come on, let's put away these obstacles and work together to upscale e-health. Later it was joined with these organizations at the bottom. Also my organization is in this. And this led to a kind of covenant, a policy document in which the directors of these organizations, policy people, really personally undersigned this covenant and said, well, if there are issues in specific projects in the field of finance, I'm an insurer, I'm the head of the insurers, I will solve this subject. If in some specific project there is a problem with familiarity, okay, I'm head of the patient organizations, I will solve this problem among the members of my organization. If there is a problem in standardization, one of the members undersigning the covenant will say, well, I will take care that this problem is taken away. So this is how we engage these organizations in working together to take away these obstacles. I'm not saying this is working everywhere, but this is actually the status of e-health in the Netherlands. We face these problems and this is how we try to solve it from a policy point of view. This is supported by an e-health action plan in research. It's the Netherlands Organization for Health Research and Development is funded by the government, and they sorted out all kinds of research which are supportive of this covenant. So all stakeholders work together. There's a lot of research in many respects in the Netherlands. I work at the Center for E-Health Research and Disease Management at the University of Twente.